never too late to answer God's calling at any age. And to do his work at any age. My wife and I teach at my church in Suitland, Maryland. We just love serving in the church, and I'm going to school pursuing a biblical studies degree. So I'm grateful for the quality of life that I'm having right now. My name is Elliott Stevens, and I received a new kidney at MedStar Georgetown University Hospital. And I'm grateful to God for giving me a second chance at life. I contracted hepatitis C at a young age, probably before I was 10, because of blood transfusion, after I had a medical issue when I was young. And then as an adult, diabetes brought my kidneys down to a level where they weren't functioning anymore. And then I had to go on dialysis. And there was a minimum of a 7-year waiting list to get a kidney. I've worked for FedEx for 28 years, and I retired. And I was really excited. I was at Bible college, but because of the dialysis, 3 days a week, 4 hours a day, it really drained me, not just physically, but mentally as well. And I had to drop out of school, and it really discouraged me. But I was on the waiting list at Georgetown to get a kidney. And around 11:30 one night, the phone rang, and it was a surgeon from Georgetown. He had explained that a young man had been in a car accident. His kidney was a perfect match, and it was being flown in by helicopter from Philadelphia. And we had to get to the hospital right away. But there was a twist in the situation because his kidney had hepatitis C.
There are a limited number of people who can receive hepatitis C positive kidneys. We restrict them generally to patients who have already had hepatitis C, where the risk of gaining the disease from the donor is no longer a concern for us. Fortunately, Elliott had a history of hepatitis C. And by offering him a chance at getting a hepatitis C positive organ, we were able to cut down his wait time tremendously, from 7 to 8 years down to about 1 year. In fact, he did get his kidney just 400 days after we put him on the transplant waiting list.
So I was put on a medical plan for the hepatitis C. I followed the regimen, and Dr. Gilbert told me the good news that there wasn't a speck of hepatitis C in my body. He said it would be cured, and it was, and I'm grateful for that. I feel great. I'm 61 and I'm going back to school. I know it's late, but I'm really enjoying the dream that I had, and I promised the Lord I would serve him until I die, so I'm still living, so I still have work to do for him, thanks to a kidney transplant.